This is the Emergency Medical Minute, sponsored by Health One.
All right, recently I was listening to some medical education. It was talking about patterns of injury in non-accidental trauma. Thankfully, we work in a center where we don't see a ton of this. It's almost guaranteed that each one of us has missed a child who has had some non-accidental trauma. If you look at the numbers for kids that have kind of verified non-accidental trauma, if you go back and look at their history, the overwhelming majority have had 2 visits to medical providers leading up to that, in which the patterns of injury weren't missed. But here we tend to see a lot of cyclical vomiting, back pain, alcohol intoxication, much more than non-accidental trauma, thankfully. But in this medical education, there was a good mnemonic for remembering the patterns of injury that should kind of raise your suspicion. We know not every weird injury is a result of child abuse. You know, you could picture a mom accidentally falling on the stairs while holding her infant, and that would result in some really weird injuries that you wouldn't expect. But whenever we see these, our suspicion should be aroused and we should consider reporting. The mnemonic, you don't have to remember the mnemonic. I learned dozens of mnemonics in medical school. I literally remember 2 of them that I still use on a regular basis. But just listen carefully and think, would I suspect each of these weird injuries to be potential child abuse, or would that not trip my radar? So the mnemonic is 10-4 faces, the 10-4 like you'd use on a radio, like 10-4 good buddy or a CB. So the 4 refers to age, either 4 months or 4 years, and we'll get to that. But these are patterns that you generally should not see. So 10, the T would be torso. You shouldn't see bruising to the torso at all on young kids. Ears, injuries to the ears from pulling on the ears or hitting kids on the ears. That's also a highly suspicious area of injury. And then the neck, kids tend to not get injuries on the neck. So if you think of little toddlers running around, what do? Well, like they bang up their shins from hitting things. Their heads are big, so they fall and hit their forehead. That's really common to have injuries in those areas. They might fall on their arms or scrape their arms or knees. Those are all common, but these other areas are uncommon. So that's the 10. What do we say? Torso, ears, and neck. And then the 4 refers to any of these bruises in kids under age 4 would be unusual. And then any bruising at all in a child under 4 months shouldn't happen, right? You think about it, they're either in a car seat or in mom's arms or something. They just don't get bruises. They don't have a mechanism for doing that. And then the faces would be frenulum, so the little divider that hangs down on your lip, right? That little soft tissue. Either from like forcing a child to eat or pulling on the lips. That's a common pattern of injury. A would be angle of the mandible, like pulling on the kid. That's another area of bruising that you can see. C would be cheeks. Kids tend not to fall like right on their cheeks. E would be eyelids, and then sclera, subconjunctival hemorrhage. So if you see any of those in a kid under age 4, it's just a highly unusual injury pattern, and you should start to think about whether that's someone that needs reporting. Kids, again, just one kind of last story, kids can get weird injuries that aren't child abuse, and the example in my family is when I had just 2 boys, and the oldest was like 2 years and maybe 4 months, and then his little brother was 4 months. So big brother was in a high chair, just sitting, locked in, eating his food, and the infant was way across the room on a blanket, just laying down on his back, happy. And my wife stepped out of the room for just a second. She came back in, and the baby had blood all over its face. And the 2-year-old was still in his high chair with like no weapon to be found. And it turns out that he had chucked his fork and hit exactly between the eyes, hit his brother on the nose, like exactly between the eyes with little fork tines that you could see right there. So weird injuries do happen, but we didn't get turned in for child abuse at that time.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.